Hi everyone, here this is me Megha Mawande again, live on Trio Raising Parents, talking to you today about all things toilet training. I'm hoping that I can be heard right now. Earlier I wasn't being able to be heard, so please drop me a yay or a nay if you can or can't hear me. I'd really appreciate that. Yeah, wonderful. So today I have Hiral joining me. Hiral is an occupational therapist. Thank you. Good to know I'm being heard now. Hiral's an occupational therapist, and Hiral's going to talk to us about some of the training. Hi,
Hi.
Hiral.
uh,
Welcome to the live.
Hi. Thank you so much.
Thank you. Thank you for joining us, Hiral. So before we start talking about the part where I wanted to bring you in, I just want to quickly talk about something. I had to restart because I couldn't be heard because of technical difficulties. So I
Yeah,
want to
yeah.
quickly recap what I was talking about. Um, so when we're doing toilet training, the journey can look very different based on the choices parents have made in terms of whether they've gone the cloth nappy route vis-a-vis the disposable diaper route, right? And I just wanted to make sure that the parents who are choosing to use the cloth nappy route also have context and some solutions. Hiral, do you think there could be some light or something that you could put on? It's looking a little dark.
Just a second. Let me do that.
Yeah, yeah, you can do that while I'm talking about this. So, most of the parents who choose to go the nappy route, they will see that their children get trained much earlier. And that happens because from the very beginning, the context of wet and dry is very starkly present for the child. While those who decide to use the disposable diaper route, those contexts are not there. Because when we're using a disposable diaper, we're creating this false sensation of dryness. And now we have to start building this process in for the child. Now, there's a lot of reasons why people might choose one versus another. I myself have done cloth nappies, so it's not like I don't uh, believe in it, but I also know that it's extremely laborious. It's not possible for a lot of parents. I have terrible memories of waking up at night to see my daughter has soiled herself and changing like 10 things, because you don't only change the nappy, you change the clothes, you change the top sheet, you wipe everything down, everything, right? And not necessary that everyone would choose to be able to do it all the time. However, even if you're using a cloth nappy and if you start struggling with your toilet training, just as if you're struggling with your toilet training, disposable diapers, Hiral and I today wanted to explore what else could be going on. So, keeping in mind all the other conditions being there, what we've already talked about in the posts in our IG, I'm going to keep that aside and deep dive into what could the flags be. Sorry, I don't know why. Saturday evening, I seem to
Yeah,
be getting too many
it
calls
went off for
today.
5 seconds, but it's fine now.
Yeah, yeah, okay, because I'm just getting incessant phone calls. Um, you know what? Hiral, am I there? Okay, I'm seeing things. Maybe Hiral is not there and I am there. Could somebody who's viewing just say, yes, you can see me or hear me? So I know I'm not talking in a vacuum because I've just gone and put airplane mode so I don't get any more calls. Ah, we've lost Hiral. Okay, I think she's lost connection. We're going to invite her and she should join us. So, like I said, what we wanted to really talk about today was what else could be going on that could be coming in the way of your toilet training journey. Because in my work, I have worked with parents whose children are even 4 or 5 years old and they've not been able to cross over that process, or they have, and then there's a regression and things are feeling much more difficult. So, Hiral, could you share with us some of the examples that parents can be more vigilant about of what could be going on?
Yeah, so I think apart from some of the things that we've been discussing through the week, and you know, even in terms of the age, there is a huge variability when a child would be toilet trained. It can be sometimes as early as 18 months to 2 years, to as late as sometimes 5 years. And sometimes that's okay. But yes, what we can be vigilant and aware about are, if there are any underlying bigger reasons which are causing maybe like a little bit of a delay or a struggle for the child, to be more independent with toilet training or potty training and things like that. Uh, you know, because I work with children who might have some of these underlying challenges, couple of things that I would sort of like to bring, to the notice is one of the bigger things we see is sensory challenges. So when I say sensory challenges, what I mean is sometimes our understanding of our own body through the sensations coming from our body, through the sensations coming from the environment, might be different, might be processed differently for different children. And when that happens, sometimes understanding of my internal sensations of when my bladder is feeling full, or when is it that I need to go, poop, things like that might be difficult for children. And that is one of the reasons why there might be delay in the awareness and then so on, the independence of going to the toilet, relieving yourself and things like that. So sensory issues can look different in different children. So there might be children who will be sensitive to touch. And I had this little girl who would just avoid going to the toilet because she wouldn't want to sort of walk on the wet floor. And that reason was big enough for her to not want to transition from, the baby potty seat onto the big WC. And that was, a very sort of starting example of how tactile sensitivities can feel so icky for some children that sitting on the WC, walking on the toilet floor, all of that might be a big, big no. And that's why transitioning be hard. That is one of the reasons. Another reason, just, the feel of the jet spray on my bum, the feel of the wipes, the whole cleaning process might feel difficult, might feel yucky. And that is why they might prefer, like you said, these diapers which actually make you feel dry because they absorb most of the moisture and things like that. So these are kids who will be very comfortable in that diaper and then transitioning again, making them go off diapers, using the potty seat and all of that would take some time. Another thing sometimes, and this might be very like simple sort of common sense, but children sometimes would not be comfortable when their feet are dangling off the big WC.
That's such a
So
simple, big one.
it's a very simple thing, yeah. But sometimes we just tend to miss it because we're so
Big.
used to just like going there and sitting, right? So and more so in our children when there are sensory challenges, because with feet being off the floor, they might actually lose their sense of security to the floor, to the ground. And that sense of security is so important, especially when you're doing something like, you're relieving yourself and you're doing this whole task of you need to be relaxed to sort of empty your bowel. And that brings me to my next point about, how anxiety and how some of these emotional challenges can then also play a role in the child sort of being sometimes constipated, sometimes having irregular schedule for bowel or bladder movements and things like that. And I think that's a very, very important point we need to consider along with the sensory or the physical based challenges that anxiety is sort of directly linked to your sympathetic nervous system, which is the part of your brain that makes you ready to sort of fight and flight in situations where you feel that you are at danger. And if children are in this constant state of anxiety due to whatever reason, there's a high chance that relieving themselves is something that they will find hard. And they might tend to be constipated, or they might tend to have irregular sort of bladder bowel movements, and then they might end up having accidents. So that is one of the important things to consider. And I think anxiety, and of course then it comes back to the whole co-regulation bit, where my anxiety is going to reflect onto the child. So I think when I'm in the process of potty training that little toddler, of course, it's important that we are sort of at ease, and there is absolutely no important or no fixed timeline that this is when it should happen. I think it eventually does. The other sensory things that we need to look out for
Sorry,
is
could
how,
we just take a break and unpack what you have said, and then
yeah,
we can talk about the next part? Because I think you've brought up already some very important points. So, one thing I think you brought up, two things in terms of the sensory needs and picking up from the previous information we've already collected, and people can go and see the hidden sensory um, senses that we have is interoception, and the second one is tactile, that could play a role in the child's ability or to get toilet trained. So whether it's the wetness of the floor, whether it's their feet dangling, whether it's noticing when they are done, the preemption of being done, of being able to differentiate between what is this feeling that I'm feeling and what is the action that I'm supposed to do, because that impulse has to give me information. But if the impulse isn't giving me information, then I don't necessarily know what to do next, right? So these are some of the key things that we have to keep in mind. Secondly, what you were talking about, which is such a big piece, which is the anxiety, that if the child is feeling emotionally, which is why I say that do not do the toilet training before you go into labor with your second child. Like a lot of parents say, one of my tick marks is I want my child to be toilet trained when I'm still pregnant, so that when I come back, I don't have to focus on that bit. And I tell them that no, but they're going to go through an emotional upheaval. You're better off waiting till after the baby has come in. It's okay to delay toilet training by a month or two, but don't do it in the midst of an emotional upheaval. I had a parent come to me and said, my brother's getting married next month. Should I do toilet training now? I said no, because she already said in the lead up to the brother's wedding, she had to be out, she wouldn't be available. There was dance practice, cousins coming, lots of stuff going on. Not the right time to engage in these things. You might as well wait till after. So, having a sort of letting go of some of the tight reel of when I need to do it is important. Unfortunately, there's a lot of pressure that comes from schools that we will not have the child come into school till the child is in off diapers. Take advantage of COVID. So, when COVID started, it was really interesting how I got so many calls of parents all needing toilet training. They're like, we're home. This is the time we're going to make this happen. So just tell us what we need to do. So use this is a great advantage we have.
yeah,
So we
yeah.
can do the
And then
toilet training without these
some kids
things.
actually do better when they're on vacations. It's like, yeah, like I've heard parents who tell me, oh, we went to for a vacation and there the child would like just go into the hotel washroom and like it'd be fine. But when it's back here, it was difficult.
Yeah,
Yeah.
absolutely. Now, could you talk about the other sensory things that could be coming up?
Yeah, I think another important piece is then, your body awareness and your understanding of your body, which would
Yeah.
also not just directly relate to the toileting part of it, but also
Yeah.
skills like, um, do I have the skills to go climb up on the WC? Do I have the skills to sort of pull my pants down? Do I have the skills to sort of pull them back up and button them and things like that? A lot of these little skills, which lead to going to the toilet, or which lead to then coming back from the toilet, that whole process itself, if it's effortful for the child, or if it's not something that the child is confident enough, or uh, right there skill wise to do that, it might cause again hesitancy or difficulty in getting the child independent to sort of use the WC on her own or on his own. So, and that again stems from your sense of proprioception, which is your sense of body awareness. So those little movements which need coordination, which need using your body in in bilaterally coordinated fashion, removing your pants, zipping yourself, things like that. I think those are some of the motor skills which would be also prerequisites when you're looking at toilet training. But I think the big pieces again would come down to interoception. That how am I understanding signals of when my bladder is full or when I feel like going to poop? And what I can say here is your sense of interoception is that internal sense which tells you about hunger, thirst, stomach ache, any internal bodily feelings. And that is very important for the children to start sort of realizing and being aware of those feelings. So sometimes, it's not like, sometimes it might be that the sensation is not going accurately to the brain, so the child doesn't know, oh, I'm full, and then there is an accident. Sometimes the sensation might be going fine, but if the child has attention-based challenges, then the child might not attend to that sensation, which again would cause accidents, or like a lot of the times we see children, they're engrossed in something, and that's when they might have an accident. And that's again attending to that sensation and then doing something about it. Another important piece that I see is the communication and the language piece of it. That going to the washroom is one thing, but do I have the skills to express myself or indicate to a caregiver that, mama, I need to pee, or mama, I need to do this, or mama, take me to the washroom, whatever it might be. So sometimes when you see children with language and social sort of communication based deficits, you see that the communication or the indication is hard because they might not feel the need to, or they might not have the necessary expressive or communicative skills to tell it at the right moment. So that's another area that you want to look into when you're looking at getting a child ready, or when you're looking at challenges in potty training. So have you also made a sort of come across these things?
For sure. Thank you, Hiral. I was taking notes because I think you put it down so beautifully that the three flags that we really look at is the interoception, where the child might not be aware. There's a possibility that the child is aware, but the child doesn't know when it's the right time to communicate because of their attention-based challenges. Or three, that the child is not necessarily picked up the skills for communication. So even though they're aware and they want to do something about it, they're not necessarily using the right skills for communication. And I know even in the work that we have done so many times that these flags have come up when parents come to me. And after we do our process of elimination and see that have we followed all the right modes, if we're still struggling with toilet training, I think it becomes really important to bring in an expert like an assessment evaluation of occupational therapy, because this becomes such a ripe ground where parents get a chance to actually start seeing how these senses might not be entirely working in the way we need them to for the child to carry on their processes. Yeah, no
That's the
worry. Yeah.
yeah.
Yeah, you're good.
Yeah, yeah,
So
yeah.
I think it's important, which is why I was keen for us to have this conversation, because when parents, because what I see in this journey is at first there's a lot of everyone can do it. Then it is, why can't my child do it? Then it is something wrong with me that I can't get my child to do it? Right? And like you said right in the beginning, that the anxiety doesn't help. in any of this, whether it's the anxiety coming from the parent or the anxiety coming from the child. And it's very important that we feel held, supported, and realize that if it is a struggle, A, maybe I just need a better process, but B, that this could be shedding light that something else is going on. And getting in touch with somebody to help you figure out what that something else could be is not a bad idea. I can think of at least 3 situations when the parent came to me for this, we started talking to you, and we realized the child is on the spectrum, right? And it became a whole journey of discovery. And the moment we were able to go through those loops and those processes of understanding that toilet training was just the tip, it was just a small thing that became obvious. So I'm saying that parents also need to recognize that if it's feeling too hard, it's maybe
Yeah,
because there is
there might
something
be
else going
something
on.
underlying, and it might help us actually understand the child better, rather than sort of going over that cycle over and over again. And I think,
And beating
and sometimes
oneself.
it might be, well, yeah, beating yourself up. And sometimes it might be quite indirect. It might not directly seem like, I know children who are picky eaters, and then there is delay in toilet training, and that sometimes is a huge link, because then it's the diet, it's the food, it's the fiber intake, and then it's the, the routine of the toileting which impacts, which again might not directly seem as if why should this affect, but there might be links which we might be able to
Absolutely.
connect. Yeah.
Absolutely. See, we know for sure that the circadian rhythm plays a big role in all of these functions, whether it is the meals, whether it is the releasing of the bowels, because it's all interrelated, right? So I end up working on sleep schedules, on meal schedules, and everything to help the child get into their toilet training rhythm, because
Yeah.
it is a rhythm, right? To train the bowel to go in, like I tell people, it's not like you're training the child to tell you they need to go to the toilet. You're also training their muscle systems to hold and release on order
Yeah.
instead of at will. So there's all these processes that we need to build in, and we need to keep that in mind when we're doing the toilet training. It's not done in a silo, in an isolated process. It's all interconnected, and at the center of all of this is, of course, the emotional state of the parent and the child. Like I had this parent on in a very hectic job, and she would literally say, "Okay, I have 3 days. I need to toilet train." And I said, "No, you don't. Take a week off." And she's like, "Oh, if I take a week off, I have to go to visit my in-laws for that week." I said, "Then you do your toilet training there, or you cancel your going to your in-laws for that week." And then she realized, because it just gave her a window to think, that why not do the toilet training at my in-laws? And she went there, and her mother-in-law also was able to help her through the process of toilet training. So sometimes we just make it hard for ourselves because we're just not able to line the ducks up. But sometimes it is hard, and it is a flag for something more. So having a
Yes.
conversation cannot harm anyone. So
Absolutely.
thank you, Hiral. Is there something else that you think we can share and shed light on toilet training related, sensory OT related challenges?
No, I mean, I'd just like to say, whether it's an OT sensory related challenge, whether it's related to language, whether it's related to emotional piece, I think, like you said, primarily, I think us being sort of regulated enough during this phase, and us sort of being prepared enough realistically will help us to make the process, even if it's longer, make the process sort of less stressful and less hard on us and the child, because I think there's a lot of, I need to do this by this age and then by this age and by this age, which I think is not needed, it's not necessary, and it's not even important. So I think the irrespective of the underlying challenge, I think seeking help, talking to the right person is important, but at the same time I think giving it time and making sure that you're keeping your and the child's emotional health first is something that I would, equally prioritize.
Absolutely. And thank you for also sharing that it's such a wide timeline, right? From 18 months to 5 years, and it could happen at any time. So a lot of parents come and say, oh, but my older one is still not done, but my younger one is done so quickly. It's okay. It doesn't
Yeah,
necessarily mean anything much. It could mean something, but it doesn't have to mean something because
necessarily.
it is that wide,
Absolutely right.
that range.
Absolutely right. It might just be an individual variation. Yeah.
Yeah, I had a parent who actually managed to toilet train her 2 year old and her 5 year old within the same 2 weeks when she came to me because she said, I'm not going to start my younger one till you tell me what to do. And I don't know what I've been doing with my older one, but it's been 3 years and I'm not there yet. And in 2 weeks, she was done, and she was like, I don't know how I just got done. I was like, yeah, well, you
Yep.
did.
Yeah. That's great.
So thank you.
Okay.
Thank you so much, Hiral. Thank you for joining us today. It's been
No
really
problem. My
important
pleasure,
to
Priya.
capture this conversation for all those parents struggling with this and not necessarily knowing where to go. I think there's just so many systems there, but not enough information as to how these things connect with each other. And once parents start to understand, I feel they're able to be more intuitive in the process. So thank you for sharing that knowledge.
Thank you
See
so
you.
much. Great talking to you, Megha.
You too.
Bye.
Bye.